will move to Dr. Henry. Are you present there, sir?
Yes, I'm here.
Yes, sir. So, for 1 minute, I have to introduce you. Dr. W. Henry is PhD, and he is a clinical psychologist with a wealth of experience. He has expertise as a clinician, trainer, consultant, and researcher in a number of services areas including substance abuse, HIV/AIDS, criminal justice, mental health, and behavioral health. Currently, Dr. is an assistant professor at the University of Maryland School of Nursing. He also has served as an associate director for the Maryland Baltimore Country Department Psychology Center for Community Collaboration. And Dr. Henry also provide consultation and training to public and private agencies. He is a president of Baltimore Homa Community BSC. It is a non-profit organization dedicated to supporting a loving and sustainable way of living based on the practice of Agnihotra and Homa. So we will move forward to Dr. Henry, how Agnihotra and its role in our mental health. The topic is mind training and Agnihotra. Sir, now it's your turn to present your view.
Yes, thanks for having me. Um, so Sri Vasant used to say, the mind is rationalize, justify, or defend anything. The mind is, the undisciplined mind is undependable. The undisciplined mind can be not only unhealthy, it can be destructive. And in today's world, the mind is particularly challenged because we're overstimulated everywhere, everywhere. There are constantly forces that are trying to program our minds. The mind is basically like a computer. Whatever goes in will come out. And some good things come in through our families, our loved ones, our education systems, our community. Some good things come in. But there are also some not so good things that are coming in all the time. Matter of fact, there are whole industries that are based on influencing how we think. There was research done in the U.S. a few years ago that said the average person in the U.S. sees 2,000 commercials a day. And that just means turning on the television, going up and down the street, looking at signs and such. That's 2,000 sophisticated attempts to influence how we think and what we do. Having been to India in some of the cities, I would think it's comparable. There are lots of forces that are trying to influence how we think, and what we do. And so we're pretty much past the time as a society worldwide where a laissez-faire approach to developing our minds will work, where we can just do it casually. For us to be healthy, successful, productive, requires that we be intentional about programming our minds. Agnihotra is a material aid to that programming process. As was said earlier, it helps to calm the mind. And when the mind is calm, it goes to deeper states of functioning, it quiets, and it's more easily influenced. As long as it's agitated, as long as it's overstimulated, it is dealing with a lot of stress and it's not dependable. The mind must be quieted in order to function in its best state. So I started Agnihotra in 1974, and I was very fortunate. We had a couple communities in Baltimore, and at that time, there were a group of us who were mental health professionals. psychologists, social workers, counselors, right? And we formed what was called the Baltimore Family Life Center. And there we did foster care, we did behavioral health, we did some substance abuse treatment. We did a variety of behavioral health interventions. The center of what we did was Agnihotra. We did Agnihotra actually on the premises of our offices. And we began to notice some things. It had a parallel effect on both the therapist, the interventionist, as well as on the clients. And I see some of those to this day. And it went something like this. When, how should I say? Oh, let me back up a little bit. Out of that, several intervention models have been documented and developed to work with individuals and families. Models and frameworks are good and are necessary. They help us to focus when we're doing clinical work, but they also keep us out of the way. They help us to have a more pure interaction, because ultimately, more than the technique, what is really helps the change process is the energy of the people involved. So as an interventionist, if my energy is pure, if my prana is high, then I am going to be more effective in trying to facilitate a healthy interaction with the person that I'm working with, and vice versa. What we also noticed is that when clients came in the office, and to this day, I have an office in my home, see the same thing. Folks come in, and one of the first things they comment on is how calm it feels, how peaceful it feels. And what we've discovered over time is when clients feel peaceful, when they feel comfortable, when they feel, when they de-stress, they're less resistant to change. They are less resistant to change. They are more open, they feel safe, and are more likely to try something out of their comfort zone with the help of a therapist. So real quickly, I'd like to just share with you one of the formats that we were taught for as therapists to use and to do with our clients in the context of the models that we use. And we call it this, we were taught this as the 7 rules of thumb. 7 rules of thumb. And the first one is no fault finding. No fault finding. That means that instead of looking for the deficit, looking what's wrong, looking how somebody is not functioning, we're looking for what is working, how they are functioning, what their contribution is. Now that's a little bit different how most of the systems work. Those of us who work in the systems know that in order to get paid, we have to put down what's wrong with a person. And that diagnosis is based on comparing that person to other people. Well, actually, comparison is one of the most violent things you can do with a person, because each one of us is a unique manifestation of the divine. When we look at strengths, capabilities, resilience, capacities, and we can see that person's uniqueness and support it, we are helping them be what they are intended to be. We're helping them to find their purpose, their rhythm on the planet. So no fault finding says that we're being strengths oriented and we're looking for what's right, what the person is capable of, how they fit. We're looking for what helps them be their best selves. Number 2 is discrimination. Discrimination is making the best decision one can make and being consistent with that decision. Clarifying our goals, objectives, and making commitments to follow through in a way that, how should I say, encourages the universe to give us feedback. Whatever decision we make, The universe is always going to give us feedback to let us know whether we're on target, off target, need to shift a little bit this way or that. But the first thing we need is a decision. A decision. The more consciously, the more intentionally we make decisions, the better we get at the process. The better we get at the process. Anything like anything else, the more we practice, the better we get. Number three, or actually number two, that was number three. The other one, next one is single pointedness. Single pointedness. And this is the issue of focus. I mean, many of us know that the process goes concentration, contemplation, meditation. When we focus our minds get off of the surface. Research says that most of us use only 10 to 15% of our minds on a good day, when we're feeling well, when we're sober, when we're well rested. Otherwise, it can get a little tricky there. So that says that there's about 85% of our minds that are subconscious, that are below the surface. And what's required for us to access that is for the stillness. Be still and know. Be still and know. So when we're focused on one thing at a time, we develop the ability to go deeper. Agnihotra quiets the mind. When we decide what we're going to focus on, it begins to go deeper. And we can access the more subtle parts of our mind, and therefore use that informed information to make more informed decisions about what we're going to do. So that issue of single pointedness helps us to utilize the full capacity of our minds. And remember, I'm talking about this in the context of a society that's constantly bombarding all of us with stimulus all the time. I mean, few of us live now in rural areas where we only interact in our lifetime with 100, 150 people. Most of us are bombarded with stimulus all the time. Every time we turn on our phones, every time we turn on the TV, watch the news, we are bombarded with all the stimulus. And all the stimulus is somebody's agenda for us. Somebody's agenda. Want us to buy this, accept this theory, believe this, see things this way. When we can be singly focused using the process of Agnihotra, we can go deeper and get more out of our minds and make more intelligent decisions about what it is we want to focus on and how we want to be in the world. How we want to be in the world. Because if we're not making those decisions intentionally and following through with them, believe me, there are many, many other entities that are working on that very hard. The fourth one is non-attachment. Non-attachment. Non-attachment, to me, has always been the most subtle of these rules of thumb. It basically means letting go, acceptance, surrender. It means accepting that I am not in charge. My job is to do the best I can do and let the rest go. Now, as scientists, most of us know that our society doesn't run that way. We are outcomes driven. Everything is measured by outcomes. So it's not successful unless I can get you to do what I want you to do. Non-attachment says something a little different than that. It says, my job is to have a healthy interaction with you, and what comes out of that is what comes out of that. I have met clients in my younger days who I thought I had failed with because they didn't meet the outcomes that I had for them. And several of them told me, oh, no, I got a lot out of what you gave me, because they were looking at their lives in a different perspective than I was. They weren't measuring by the same yardstick. One client told me he had gone to jail. And I said, well, he said, I'm going to thank you for all you did for me. I said, but you went to jail. He said, no, you don't understand. You need skills if you go to jail. And I was probably headed to jail a long time before I met you. So again, this is really the actualization of not my will, but thy will be done. My job is to do the best I can with giving, helping the person, giving positive energy, helping them to be single pointed, to make good informed decisions. And whatever comes out of that is what comes out of that. And then it gets simpler from that, the last three. When in doubt, think something good. Think something good. When you are sitting with somebody, whether it's a family member, a child, or a client, and you're thinking a negative thought, that negative thought communicates. Whether that person is conscious of it or not, it influences that relationship, it communicates. If ever I have to come see you for service, if you can't think good things about me, let me know so I can go somewhere else. When you think good things about a person, you help them to be that way. You join that energy, you bring that energy out in them and create positive force that is healing, that is healthy, that helps them to actualize. So it's think something good, say something good, be affirming, be supportive, be acknowledging. One of our mentors who did Agnihotra used to say, we want to aggressively look for monuments, something to say, good job, I like that. That's what's working. Because we know from operant conditioning, again, whatever we acknowledge, we begin to reinforce. We begin to reinforce. So we want to look for the exceptions to the rules sometimes so we can find things to reinforce and say something good. And of course, the last one is what? Do something good. Think something good, say something good, do something good. Because we want to demonstrate, we want to model, we want to interact with whoever we're interacting with in a way that shows our commitment to living our highest life, our commitment to believing in them, to believing in the divine, and to surrendering to the divine's will. So again, this 7 rules of thumb: no fault finding, single pointedness, discrimination, non-attachment, think something good, say something good, do something good. A framework to help us, energy to be pure, to help us to be available, to help people to actualize their path, their potential, without our judgments, without our agendas, submitting to a larger understanding of who they are and what we're doing on this planet. So in order to do that, that has to be applied not only to the client, but to us as providers. It's a parallel process because we have to work on ourselves continually to have something to give to somebody else. Thank you for that moment. Mind training, a focus for us all.
Thank you very much, sir, for presenting your views and giving your valuable time to us. And your knowledge is very helpful. And we will request you to remain in the webinar. We have also some speakers left who are presenting or going to present his views on very interesting topics. Thank you very much, sir, again.